Addictions and other drugs. This is not the conventional stuff. Well, maybe it is more conventional. Who knows? Well, let's get into it anyway and figure out what's going on here. Other addictions, other drugs, inhalants, volatile liquids, aerosol sprays, gases that come in pressurized tanks. These substances have many of the same psychoactive effects of street drugs. And they're out there, and our kids are using them. Sports drugs, natural and synthetic substances, accelerates the healing of injuries, increases performance. It alters the state of the athlete's consciousness. Hard to classify drugs, animal extracts, herbal preparations, smart drugs and drinks, nootropics. They've been used for their psychoactive effects. They've been used to improve mental health. They've been used to improve physical health. Inhalants are used because the user finds it stupefying, intoxicating, and occasionally psychedelic. There are three main groups of inhalants: volatile solvents and aerosols, volatile nitrites, and anesthetics. Most of the volatile solvents and aerosols are synthesized from petroleum and mixed with other chemicals. Hydrocarbons are found in glues, gasoline, nail polish remover. Many aerosols are inhaled for their propellants rather than their ascribed contents. Other volatile organic compounds include esters, ketones, alcohols, and glycols. When I was in the service, of course, we used to clean things with esters, ketones, alcohols, and glycols. The volatile nitrites include butyl and amyl nitrite. These drugs are used as vasodilators for the people with heart problems. They have also been used in air fresheners. Illicitly, they are used recreationally at parties, but especially in sexual situations. And I will be explaining those sexual situations in just a moment. Anesthetics are used to block pain or induce unconsciousness for medical procedures. Nitrous oxide is used in dentistry for anxious patients who do not wish to use Novocaine. Also called laughing gas, it is uncommonly used at parties to induce giddiness and euphoria. And that's what these ladies are taking in. They're taking in nitrous oxide from those balloons. The most widely used inhalants are nitrous oxide, nitrites, gasoline, glue, spray paint, aerosol sprays, lacquer thinner, correction fluid, whiteout. Inhalants are sought because they are quick-acting with intense effects. They enter the bloodstream within 7 to 10 seconds and may last from a few minutes to an hour. They are cheap, readily available, and widespread. There are more than 1,500 chemical products that can be inhaled for their psychoactive effects. They're readily accessible to children and adolescents, as many exist in anybody's garage or home, except mine, of course. Since we've moved so much, every time we move, we get rid of that stuff. They have more direct toxic effects on body tissue. There's a lack of awareness of inhalants as drug problems. Inhalant abuse is most prevalent among adolescents. Inhalants account for from 700 to 1,200 deaths in the U.S. per year. This is a worldwide problem, as cheap highs are sought by the young, the poor, the street children, recent migrants to cities, indigenous peoples, and children of parents who work at home with volatile chemicals. The inhalant of choice in many poor countries is gasoline because of its availability. Inhalants are most likely abused by 12 to 17-year-olds and more females than males. This problem was especially serious in the 1990s, but has since dissipated. American Indian and white adolescents are more likely to use inhalants than blacks or Asians. There are 7 methods of using: sniffing, breathing in the inhalant through the nose directly from the container; huffing, soaking material and putting the material over the mouth and nose; bagging, soaking material and placing the material in a bag to be inhaled through the nose or mouth; spraying the inhalant directly into the nose or mouth; Balloons and crackers, puncturing a can of inhalant and capturing it in a balloon for inhaling. And that's what we just saw a second ago. Masking, spraying an aerosol in a bag and then putting the bag over your head and just putting it on your clothing. And I can tell you from working in the emergency room, especially I was working in the emergency room in the 1980s and 1990s, and this was very, very common to have people come in with these inhalants all over their clothes. Of course, they didn't think anything about it, but of course, it just about knocked us out, the people in the emergency room. Volatile solvents are carbon and hydrocarbon-based compounds that turn to gas at room temperature. Gasoline, gasoline additives, paints, especially metallic paints, kerosene, air dusters, paint thinners, lacquers, nail polish remover, spot removers, glues, and plastic cements. Lighter, not to mention lighter fluid, of course. Volatile solvents are absorbed very rapidly into the blood and move to the heart, brain, and liver within 7 to 10 seconds. It causes temporary stimulation, elevated mood, it reduces your inhibitions, it makes you impulsive, it gives you excitement, it makes you irritable, dizzy, slurred speech, unsteady gait, and drowsiness. These inhalants are exhaled by the lungs and excreted by your kidneys. After prolonged inhalation, the user may experience delirium with confusion, psychomotor clumsiness, emotional instability, impaired thinking, and potentially they'll go into a coma. Long-term effects of inhalant use, arrhythmias and myocarditis. Myocarditis means that your heart swells up. Pulmonary hypertension, respiratory distress and lowered breathing capacity, liver toxicity, carboxyhemoglobin may cause brain damage. Some inhalants may cause neonatal growth retardation, odd facial features, and tremors in newborns. While most huffers move on to other drugs, those who stay with inhalants can expect some fairly debilitating effects. Poor coordination characteristics, inability to concentrate, weakness, disorientation, weight loss, memory loss due to hippocampal interference, poor problem solving, difficulty controlling one's behavior, blood irregularities, chromosomal damage. Chronic huffers tend to have antisocial personality disorder, but it is not sure whether the huffing causes the behavior or the environment that they live in. These individuals also tend to use whatever drugs they come across. The most widely abused substance is toluene, also known as methylbenzene, because it is such a good accelerant and is in so many products. It's in glues, drying agents, solvents, thinners, paints, inks, and cleaning agents. 65% of chronic abusers of toluene have neurological damage. Neurological damage is one of those things that you never recover from. It is permanent. Toluene and benzene, the huffer's high. There you go. All right. Trichloroethylene, TCE, is another common solvent found in substances used for huffing. Correction fluid, paints, metal degreasers, spot removers, extracting oils and fats from vegetables. It causes depression and moderate hallucinations. If used heavily, it can cause neuropathy. Some of these neuropathies can be permanent. And there you go again. Maybe not the best stuff to try. N-hexane and methylbutyl ketone, MBK, are solvents used for glues, solvents used for additives, diluents for plastics, diluents for rubber, in the production of laminated products, as a paint thinner, as a solvent for dyes. And if you've ever sniffed something that had just been laminated, usually you get a really strange odor. That is the methylbutyl ketone. N-hexane and MBK have been shown to cause neurological damage, especially in the brain. Recovery can take up to 3 years. Whoops. Small molecule alkanes are gaseous at room temperature and cause cardiac arrhythmias and sudden death and include methane, ethane, butane, and propane. Large molecule alkanes are also neurotoxic and include hexane and pentane. Gasoline is readily available and used as an inhalant, especially on American Indian reservations. The effect only lasts for about 3 to 5 minutes. Not only are the hydrocarbons neurotoxic, but the solvents, metals, and additives can cause problems as well. Insomnia, tremors, anorexia, paralysis, lead poisoning, if there is lead in your gasoline. Once upon a time, all gasoline had lead in it. Not anymore. They've taken the lead out, mostly. Unless it's jet fuel. Jet fuel still has lead in it. The lead poisoning can cause brain, liver, bone marrow, kidney, and lung damage. Residual effects might last for 5 to 6 hours. Over half of all inhalant deaths are due to gasoline inhaling. Alcohols are the most frequently abused inhalant solvents: methanol, ethanol, and isopropanol. When inhaled, alcohols can produce a mild high along with nausea, vertigo, weakness, vomiting, headaches, abdominal cramping. And there's somebody huffing alcohol. That's how it's done. For ER personnel, it is important to know the warning signs of solvent abuse. Headaches, chemical odor on the body or clothes, and I'll tell you what, it's in their lungs, it's on their clothes, it's in the room, and you can't get away from it. Red, glassy, and watery eyes with dilated pupils. It's not like you can sneak in if you've got this stuff on your clothes. Nosebleeds, inflamed nose, rashes around the nose or mouth, slow, thick, or slurred speech, staggering gait, disorientation, lack of coordination, pains in the chest and stomach, fatigue, nausea, shortness of breath, loss of appetite, intoxication, irritability and aggression, seizure, and of course if they go into a coma. Now if you look at all of these things, that's just about everybody that comes in the emergency room with just about any problem. That could be the flu. It could be COVID. Nitrites have been used as medicines, especially heart stimulators for angina. Angina just means pain in the chest. Since the 19th century, alkyl nitrite, isomyl nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, cyclohexyl nitrite. These are all the nitrites. And that's how you wake somebody up. That's how you get their heart to stop hurting. Nitrites dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning. It takes 7 to 10 seconds for the effects to take place and lasts for 60 to 70 seconds. Nitroglycerin, the nitroglycerin tablets you put under somebody's tongue. You can put these poppers right under somebody's nose and it takes care of their angina. The blood pressure lowers, but it only lasts for, a minute. The blood pressure lowers and hits its apogee at 30 seconds and returns to normal at 90 seconds. Nitrates also are sometimes called poppers, and that's because you can put them right under. This is like waking somebody up. Nitrates cause a feeling of fullness in the head, a rush, a mild euphoria, dizziness, and giddiness. Now, why is this happening? Because it's a vasodilator, and all your blood vessels are suddenly expanding. As the inhalant burns off, they might experience headaches, nausea, vomiting, and chills, and this is because your blood vessels are shrinking again, back to normal. Excessive abuse may cause oxygen deprivation, fainting or passing out, temporary asphyxiation. Overdoses do occur and necessitate taking the victim away from the nitrite. Remember, it's a vasodilator, so it's going to, oh my goodness gracious, it's going to make you your head swim is what is going to happen. And then when you take it away, they go back to normal. And if their normal is, passing out, then they'll pass out. CPR might be necessary to maintain heart rhythm and respiration. Chronic users will have a reduced oxygen carrying capacity due to methemoglobin. Nitrites are used to enhance sexual activity by increasing blood flow to the sexual parts and relaxation of smooth muscles. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. Unfortunately, nitrites impair the immune system by inhibiting the functioning of white cells. Nitrites also convert to nitrosamines, which are cancer-causing chemicals. So if you want to have anal intercourse with somebody and their anal sphincter is closed up, you use one of these poppers. It will relax the anal sphincter. If both of you use it, then it will enhance the male erection, and it will allow the anal sphincter to open up. There you go. Poppers, when used with Viagra, cause lowered blood pressure in users since both medications lower the blood pressure. When these two drugs are used with methamphetamine, people have been known to faint or even die. Volatile nitrite abusers are notorious for multiple drug use. 2/3 use at least 3 other inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. Anesthetics are used to slow the central nervous system and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be abused was nitrous oxide. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects. Nitrous oxide is sold in small plastic containers, canisters to be used in cooking. And there you go. That's what it looks like. Nitrous oxide effects include dizziness, giddiness, and disorientation, silly laughter, buzzing and throbbing in the ears, visual hallucinations, confusion and headache, feeling that one is about to pass out, impaired motor skills, and fainting. The effects only last 2 to 3 minutes. Cognitive functioning is impaired with the drug, but returns to normal after about 5 minutes. Long-term exposure can cause peripheral and central nervous cell damage due to a lack of oxygen. Nitrous oxide replaces oxygen in the blood. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and legs, cardiac arrhythmias, asphyxia, seizures, and maybe even death. Let's see if his head turns into a balloon. Now somebody's going to grab it and suck all the nitrous oxide out of his head. There we go. Halothane is rarely used in the West. It is widely used in third world countries because it is inexpensive and works very rapidly. This anesthetic is used primarily in veterinary procedures. It is most frequently abused by hospital personnel. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross-tolerance to other depressants, especially alcohol, if used chronically. Inhalants are seen as low class among the drug-using community, and you don't want to be seen as low class to the drug-using community. 3 categories of drugs are used in sports. Therapeutic drugs used for specific medical problems and administered through proper medical supervision. Things such as analgesics, that's painkillers, muscle relaxants, anti-inflammatories, and asthma medication. Ergogenic drugs, performance-enhancing drugs such as steroids, human growth hormone, blood doping, and stimulants, and we'll talk about those in just a minute. And then recreational and mood-altering drugs. Athletes use drugs because they perceive drugs as a quick way to put on pounds and muscle, increase stamina, get up for a game, relieve pain, and to keep up with other athletes who use drugs. Analgesics and anesthetics are used to deaden pain and include both topical, such as alcohols, procaine, and lidocaine. The alcohols can either be ethanol or methanol. Remember, ethanol is what you drink, and methanol is this stuff that's poison. You can take things orally, such as aspirin, ibuprofen, acetaminophen. Those are the over-the-counter medications. The ones that you need a prescription for, Vicodin or Demerol, hydrocodone and meperidine, morphine, codeine, or propoxyphene, also known as Darvon. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. And this is one of the reasons why I never take them. I would rather know what's hurting than not know what's hurting and do more damage to myself. I learned that a long, long time ago. A lot of people that blow their knees out or they damage their joints, a lot of the reason is because they were competing with that joint, and they gave them something to take the pain away, usually one of the canes, lidocaine or procaine. Took the pain away, they were able to exercise, but they did so much damage to the joint that now it's worse than it was before. And this was very common in athletics, especially in the higher you get, the more money you're making, you're more willing to sacrifice yourself. This happens in football all the time, happens in baseball all the time, and that can be a problem. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and are used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. Cariprazole, Soma and Vandam, methocarbamol, Robaxin, benzodiazepines, diazepam, which is Valium, clonazepam, which is Klonopin, and chlordiazepoxide, which is Librium. These are the muscle relaxants. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two classes: non-steroidal anti-inflammatory drugs, also known as NSAIDs, and corticosteroids. The NSAIDs include aspirin, ibuprofen, indomethacin, which is Indocin, phenylbutazone, butazolidine, Solindac, Clinorol, and Celecoxib, Celebrex. And there's your Celebrex right there. And the other type is corticosteroids, prednisone and cortisone. You can use NSAIDs all you want now, kinda, well, as long as you're not competing, probably. But corticosteroids, you better have a lot of damage done before they let you use the enhancers. Both types of anti-inflammatories have their problems. NSAIDs, aspirin, and ibuprofen cause ulcers and kidney problems. Celebrex is only recommended for arthritis and may cause heart and gastrointestinal problems. Corticosteroids can cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, psychosis at high doses. And of course, this is one of the things you have to be really careful of, that you think that you're fixing yourself and actually you're making your body weaker, from your muscles and your tendons weaker. This happens all the time. I had a friend who was actually from Phoenix, and he was a Mr. Olympia. He was a bodybuilder, and by golly, he started taking corticosteroids, and he tore his pec for one thing. But the other thing was his joints became really not nearly as tight as they should have been, and he kept throwing his shoulder out. Wow, that's big. Asthma medications open air passages. 10% of general population has asthma. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. Most asthma medications used by athletes are beta-2 agonists. Clenbuterol is banned during competition, and albuterol. Albuterol and clenbuterol are the two are the two major asthma medications. Vasopressin is another. These medications increase muscle energy and growth, and for that reason you can use them to train, by golly, but they don't want you to do that. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, erythropoietin. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss medication. And there are some guys on steroids, some big fellas. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemia, some breast cancers, and endometriosis. That guy is one big fella. When athletes take steroids, they experience increased body weight, lean muscle mass, muscular strength, stamina, aggressiveness, and confidence. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage. And that's how they get so massive, so massive, so massive. Wait a minute. There we go. That's not steroids, that's probably protein. He's huge. He's huge. He's huge. He's gigantic. Anabolic steroid users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% use 7 or more steroids at a time. Immediate effects of steroid use is increased muscle mass and improved muscle tone. Having muscle too large and strong for the bone and tendon structure may cause an overstressing of the muscle. It ruptures tendons and damages ligaments. Users often complain of feeling bloated because they are retaining water. Anabolic steroids suppress the natural production of testosterone. It causes enlarged breasts, nipple changes, decreased size of the sexual organs, impaired sexual function, cystic acne growth, and that's what you're looking at here, thinning hair, and more rapid balding. And this is one of the reasons why you see a lot of athletes who have shaved their heads. Now, maybe they would have had bald heads anyway, but if they took steroids, they will have bald heads because of the steroids. And then we have another big fella. Female athletes also use anabolic steroids for muscle growth and other masculinizing effects, though some are unwanted. It increases your facial hair, which is always attractive in a woman, decreased breast size, lowered voice, clitoral enlargement, cystic acne growth, and thinning hair. Most of these masculinizing effects are irreversible, so once you start, there's nothing you can do to go back to where you were before. There she is before, there she is afterwards. After anabolic steroids. There she is before, and there she is after. Before and after, she looks kind of anorexic to me. Before and after, I think she's got thinning hair. Before and after, she definitely has thinning hair. Anabolic steroids increase the cholesterol of the user, especially the bad cholesterol, the LDL. At the same time, steroids lower the good cholesterol, or HDL. Steroid users have an uncommon amount of cardiovascular problems, hypertension, thrombosis, cardiomyopathy. Because steroids encourage cell growth, they may equally encourage cancer cell growth, and this can be a problem. So if you know of any power lifters who take steroids, a lot of them don't make it past their 40s or 50s. Anabolic steroids, a lot of it has to do with cancer, a lot of it has to do with heart problems. Anabolic steroids can get into your liver as well. Anabolic steroids do have an impact on the user's mental state, at first supporting more aggressive and confident behavior. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, to depression, to psychotic symptoms, to paranoia. This emotional cycling is known as roid rage and is more pronounced in individuals who have anger issues already. While some people report a slight euphoria when taking anabolic steroids, it is thought by researchers that this is due to anticipation of intense activity rather than actual addiction. Some users do report withdrawal symptoms, and in fact, some users will use low doses during cycling to maintain sanity. There is some animal study evidence that steroid use is addictive. Stimulants are taken by athletes to make them more alert, to make them feel more confident, and to make them stronger. Much of the increase in ability when taking amphetamines is increased focus and aggressiveness. Heavy usage can lead to blood pressure problems, exhaustion, and malnutrition. And I know several people that use caffeine this way. That doesn't give you quite the jolt that amphetamines would, but I know several people that drink some fairly strong coffee before they go in and work out. Caffeine is a mild stimulant used by some athletes. At low doses, it increases wakefulness, mental alertness, slightly increases your endurance, it increases your muscle contraction, causes digestive disturbances, urine output causing dehydration, and that can be a problem. And that's what he's doing. This is a concentrated coffee. I don't drink coffee, so I don't know these things. Ephedra, or also known as mahuang, and ephedrine are mild stimulants used by some athletes. These substances are found in many over-the-counter medications. Not everyone is sensitive to these medications, but to those who are, they cause jitteriness, anxiety, headaches, high blood pressure, cardiac arrhythmia, poor digestion, and overheating. And this is an individual who used to pitch for Cleveland, and he was on ephedra when he was pitching, and it killed him. Chewing tobacco used to be a mainstay in Major League Baseball parks. From the beginning of baseball until the 1980s, many, if not most, baseball players maintained a chaw of tobacco in their cheeks almost constantly during a game. Many baseball icons of the past died of throat or esophageal cancer. It is rarely seen today. And there's Nellie Fox, who died of esophageal cancer. This is Sandoval. Pablo Sandoval used to play for the Giants, then he played for Boston, then he played for Atlanta. Played for the Giants again, then he played for Atlanta. He's not playing baseball anymore. He's one of the last guys to use chewing tobacco. Human growth hormone is a hormone produced by the pituitary gland to stimulate growth in children. It is prescribed for children who are of unusually small stature to stimulate growth, and for people with wasting diseases like AIDS to build strength. It is used by athletes because it increases muscle mass, skin thickness, connective tissues and muscles, acromegaly, cardiovascular disease, decreased sexual desire, goiter, menstrual disorders, and impotence, decreases lifespan up to 20 years, and I just had this guy's name on the tip of my tongue. He used to play for the Brewers. He retired now. He was the MVP one year, and the next year they caught him using human growth hormone. I can't think of his name. Good player. Good player, but probably he was taking drugs most of the time. That's what acromegaly looks like. It's an elongated chin. Your ear is higher than it's supposed to be. That's acromegaly. President Lincoln suffered from acromegaly. Androstenedione, or andro, and dehydroepiandrosterone, or DHEA, are natural hormone precursors to testosterone. Neither of these supplements have been found to do more than increase testosterone levels in men with abnormally low testosterone levels. They also seem to increase HDLs and the female hormone estradiol. One of the things that we do know about it is that if you don't have an abnormally low testosterone level, they don't do anything to you. Beta blockers are medications prescribed to lower blood pressure, decrease heart rate, prevent arrhythmias, reduce eye pressure. They work by blocking adrenaline from exciting the heart. They also calm the individual by blocking nerve cells in the brain. Beta blockers are used by athletes who require precision and concentration, like archers, participants in rifle shooting competitions, ski jumpers, and divers. Beta blockers do have their problems, as they cause fatigue, lethargy, dangerously low blood pressure, gastritis, occasional nausea, vomiting, temporary impotence. They may intensify asthma. They may intensify heart problems that may kill the user. Erythropoietin is a medication that is given to individuals to promote red blood cell production. It is often given to individuals who are going through chemotherapy to induce their bone marrow to produce replacement RBCs due to their problem, which is cancer, of course. EPO is used by athletes to increase stamina, though this unnatural thickening of the blood can lead to blood clots, which in turn might lead to strokes or heart attacks. My sister had cancer, endometrial cancer, strangely enough. And while she was on chemotherapy, she'd become anemic. So they would have to give her shots of EPO. And by golly, it took her about a day before she was rip snorting ready to go. She was in pretty good shape after that. Eventually, she died of her cancer, but she was a lot happier when she had enough RBCs, that's for sure. A similar problem is blood doping, where the athletes store their own blood prior to competition and then are administered the packed red blood cells to increase the stamina of the individual. This technique is used in endurance sports such as cycling, especially cycling, long-distance running, and cross-country skiing. You see this in cycling all the time, along with EPO. Athletes will use just about any substance that will give them a competitive edge: herbs, animal extracts, vitamins, minerals, proteins. Unfortunately, some of these items may contain banned chemicals and cause the athlete a great deal of trouble. One dietary supplement used by athletes is creatine. Creatine is an amino acid that occurs naturally in the human body as well as in fish and meats. Creatine is used because it delays muscle fatigue. It stores energy that can be used in short bursts. It extends the amount of time a person can work out. It helps muscles recover faster. Problems come when it is overused. It causes dehydration, stomach cramps, nausea and diarrhea, muscle pulls and strains, and kidney problems. And you certainly don't want kidney problems. And here's a guy that used creatine, and here he is on the 6th day, here he is on the 1st day. So you can see he's a little bit bigger. Gamma hydrobutyrate, or GHB, was used in the 1980s and early 1990s as a fat burner and an anabolic agent, as a sleep aid, as a muscle definer, as plant growth supplement, and as a psychedelic. Picked up by sexual predators as a date rape drug, it is now only used legally as a medication for muscle weakness. And there you go. Just drop it in somebody's drink. Some athletes will consume sodium bicarbonate 30 minutes prior to exercising to decrease the development of acidosis. This works for shorter events that take place within 10 minutes, but not for longer endurance events. It can cause diarrhea and water retention, and that's always fun while you're trying to compete. Athletes trying to make weight will resort to various techniques to drop unwanted pounds: diuretics, laxatives, exercise, fasting, self-induced vomiting, which is what this guy's doing, excessive sweating in the sauna, stimulants. Some athletes will lose 3 to 5% of their body weight in a couple of days, which seems kind of silly. Anorexia and bulimia are not uncommon among athletes who are potentially trying to make unrealistic weight levels. Another problem with weight maintenance is the opposite of anorexia, muscle dysmorphia, where the individual becomes obsessed with muscle development as they see themselves as too weak whenever they look in the mirror. These individuals are more likely to take copious supplements and steroids to combat their body's weaknesses. Athletes will often use diuretics to lose weight rapidly, to limit the bloating caused by steroids, by sucking the water out of their system to avoid detection of the illegal drugs, to lose weight, to look thinner. Athletes need to monitor their use of diuretics because of the possibility of dehydration leading to heat stroke and organ damage. Weightlifters will take adrenaline supplements combined with amyl or isobutyl nitrite to increase strength. It unfortunately can cause dizziness, rapid heartbeat, and hypertension. Bee pollen is sometimes taken as a supplement, a way of boosting energy levels, digestion, and reduce stress. Studies do not support any benefit from bee pollen. Some athletes will take calcium pangamate as a supplement. This chemical combination is sometimes referred to as vitamin B15 and pangamic acid. It is refuted to keep muscle tissue better oxygenated, though there is no scientific research to back up the claim. This substance is known as a carcinogen. Cyproheptadine periactin is reputed to be a steroid-like bodybuilder and has been used to increase body weight and muscle strength. This drug is an antihistamine. It acts as a serotonin and histamine antagonist and increases muscle mass and strength by making the individual hungry. It actually merely increases the user's appetite and has the added side effect of decreased performance, sweating, and sedation. Darbepoetin, Aranesp, is a medication developed to treat chronic anemia. Just like erythropoietin, the drug increases RBCs and thus the oxygen-carrying capacity of the athlete's blood. Human chorionic gonadotropin is a substance produced by fetuses to protect themselves from their mother's immune system. HCG, along with clomiphene and tamoxifen, is taken by steroid users to restart their own body's testosterone production. This substance also blocks the increased effects of estrogen in the male body. The drug can have an impact on the liver and reproductive systems. Modafinil Provigil acts as a stimulant and is used to treat narcolepsy. Athletes using the steroid THG will take this drug to mask the steroid. Orethine and arginine are amino acids taken to increase muscle mass because it is reputed that they cause an abnormal release of HGH, human growth hormone. Primegen is used in Europe to facilitate the release of steroids in the body. Vitamin B12 is used to ward off illnesses and provide extra energy. It can also be used to speed the recovery from a hangover, and that's what we used to do when I was working in a clinic in Oklahoma. People would come in with a hangover. You know, the banker would come in after a really hard day, and we'd have to give him a shot of B12, which is red. It's a red chemical. It's really kind of interesting. Anyway, we give him a shot of B12 so he could function that day. As has been seen, athletes will do just about anything and take just about anything to improve their performance on the athletic field. Athletes will use stimulants to boost their performance, from innocuous caffeine and tobacco to the more destructive amphetamines. Athletes will use sedative hypnotics, especially Xanax, to unwind from the stresses of competition. Sometimes these drugs are used to counteract the stimulants that they have taken to perform. The most widely used depressant by athletes is alcohol. While in low doses, the substance does not hinder performance. In most cases, alcohol is used as a reward for performance, as a way to unwind, or as a consolation after a disappointment. Marijuana is contraindicated for performance, though when used in the right mood might actually improve performance. Marijuana doesn't help athletes because it lowers your blood pressure, causing fainting during competition. It inhibits sweating, which might lead to heat prostration during exercise. Decreasing tracking ability, it hinders the ability to do complex tasks. Diminishes hand-eye coordination, decreases oxygen intake, is a banned substance by the NCAA, even though they're thinking of taking away that ban. It is illegal in 36 of 50 states. Because marijuana is fat-soluble, it continues to impair 1 to 2 days after use. And I already told you the story of the softball team, the co-ed softball team, they were playing great, and then they tried to play us at 4 o'clock in the morning after most of them had been smoking dope, and they just couldn't function hardly at all. They had to forfeit the game. There are no limits to what people will do to get high. People have been known to smoke aspirin, chew dandelion roots, drink gasoline. Individuals who have been known to mix gasoline with orange juice to make a barely palatable concoction known as Montana Gin. Drink rubbing alcohol, drink hydrogen peroxide, put Anbesol, which is a topical anesthetic, in their eye to smoke toad secretions. Mortuaries have had to watch their supplies of the fluid they use to embalm bodies, formaldehyde. When inhaled, this substance acts as a depressant and a psychedelic, but can also be used to manufacture illicit drugs. When mixed with marijuana, the substance provides a PCP-like effect and is called clickers, clickums, fry, wet, or illy. There's a name for you, illy. Raid, Lysol, and any hairspray are sometimes used for their alcohol content. Raid has been used to spray on marijuana to intensify the effects of the marijuana in a concoction known as Canaid. Kava is a plant found in the South Pacific and South America. The root is crushed and a milky white exudate is extracted, which is drunk like alcohol. The drink is reputed to have similar effects as alcohol and acts as an anti-anxiety drug. It is said to have an unpleasant flavor and numbs the tongue and lips. Human saliva is used in its preparation. There you go, drink somebody else's spit. In some Arab countries, camels are force-fed marijuana. After going through the digestive process, the camel dung is smoked for its hashish content. The Bufo genus of toads, the Colorado river toad, produces a psychedelic substance from its pores as a defense mechanism from attack. The toads are sometimes milked, and the resulting substance is smeared on cigarettes and smoked for their psychedelic effects. And that's what it looks like if you ever see one. You guys have them, they're in the Grand Canyon. So, there you go. All natural medications started out as herbal preparations concocted by shamans, medicine men, wizards, or physicians. Some of these herbs merely had a placebo effect, while others have been proven to contain chemical structures that have great benefits for mankind. For example, quinine, developed from the cinchona tree to fight malaria. The search for the fountain of youth, or merely drugs that will help the individual recover from a hard night of drinking, have recently come to the fore as smart drugs, drinks, and nootropics. Smart drugs, drinks, and nootropics are drugs, nutrients, vitamins, extracts, herbal potions such as ginseng, ginkgo biloba, and caffeine, and amino acids. These drugs are reputed to boost intelligence, improve memory, sharpen attention, increase concentration, detoxify the body, energize the user, reverse the aging process. New age smart drugs, or nootropics, include hydrogene, selagelene, vasopressin, 5-HT, which is short for serotonin, modafinil, paracetam, oxyracetam. Improves your learning, improves your memory consolidation, improves your memory retrieval, theoretically. Compulsive disorders are repetitive behaviors that the individual appears not to have any control over. They come in two categories: impulse control disorders, compulsive gambling, hair pulling, and compulsive disorders that have their own classifications, such as overeating, shopping, sexual behavior, internet use, watching television, pathological lying, shoplifting, and fire setting. Impulse control disorders are actions that may be pleasurable in the beginning, but as the attempt to resist the impulse continues, becomes harmful to the individual or to others. This disorder also has accompanying tension or arousal before the act is committed. After culmination of the act, the individual often feels gratification, pleasure, relief, and then possibly remorse and guilt for not controlling the behavior. Obsessive-compulsive disorder is a repetitive activity where the goal is to reduce anxiety or distress caused by obsessive thoughts. The goal is rarely to provide pleasure or gratification and includes compulsive hand-washing, checking things, ordering, counting, and praying. Compulsive behaviors are engaged in for the same reason people compulsively use addictive drugs: the instant rush to forget their problems, to control anxiety, to oblige friends, to self-medicate. These individuals are trying to alter their mood and change their state of consciousness. MRIs show that the same areas of the brain are activated when compulsive behavior is done, as when drug use is anticipated or done. Drug users are compulsive about their drug use. Gamblers gamble compulsively. The drug user will develop a tolerance for their drug. The compulsive gambler increases the bet amount when gambling compulsively. They build up a tolerance. The drug users have withdrawal symptoms after abstinence. The compulsive gamblers become restless when not gambling, a sign of withdrawal. Drug users continue to use despite adverse consequences. Compulsive gamblers continue gambling until they have used all their money. Drug users are in denial about their usage. Compulsive gamblers think they control their gambling and refuse to see the consequences. They are in denial. Drug users have a strong tendency to relapse. Compulsive gamblers will relapse whenever they have money again. One telling sign is that organizations like Gamblers Anonymous and Overeaters Anonymous use a 12-step program identical to the 12-step program set up by Alcoholics Anonymous. Addictive behavior involves a lack of individual control, and these organizations demonstrate the necessity to change their lifestyle and beliefs. Compulsive behavior can be triggered by various factors: genetic predisposition, environmental stress, the repetitive behavior itself. Substance abusers, compulsive gamblers, compulsive overeaters, and compulsive shoppers all show the same dopamine increase in the brain. Compulsive behavior does seem to run in families. Binge overeating has been shown to have a relationship with overactive 5-HT serotonin receptors. Twin studies support the strength of genetic factors leading to obesity. These connections were stronger than shared environmental pressures. Studies of adopted children supported the strength of genetic influences where such environmental factors such as frequency and volume of meals, amount of snack food in the house, and level of exercise was less significant than heredity toward obesity. Researchers have found a marker gene that shows a strong proclivity for addictive behavior, especially alcoholism, and we have seen it before, DRD2A1 allele. It appears in only 19 to 21% of non-alcoholics, but it appears in 69% of severe alcoholics, 45% of compulsive overeaters, 48% of smokers, 52% of cocaine addicts, 51% of pathological gamblers, 76% of pathological gamblers with drug problems, 45% of people with Tourette's syndrome, and 49% of children with ADHD. It is speculated that these individuals who have the DRD2A1 allele gene have a deficiency of dopamine receptor sites and therefore must seek excessive stimulation to force extra dopamine to be released in the reward reinforcement pathway to feel normal. Since their normal is less stimulating, they're bored, stimulation allows them to feel pleasure. Compulsive gambling may be triggered by the plethora of venues to gamble. State lotteries, poker machines, internet betting, legal off-track betting, casinos on every corner. Compulsive overeating may be triggered by the plethora of fast food restaurants, lack of daily physical activity, fats and sugars in the foods that induce craving, parents overfeeding their children, chaotic childhoods that lead people to use food to relieve their depression. Compulsive sexual activity may be triggered by a plethora of sexual situations depicted on television, latchkey kids with no supervision, children with no close emotional family connections, and abundance of internet pornography. Type anything into Google, and if safe search is off, by golly, you're going to come up with some pornography, no matter what it is. It's really kind of odd. Compulsive internet use may be triggered by expanding networks of games, massive multiplayer online role-playing games. Dedicated gamers will play online for an average of 8 hours a day. Expanding networks of online gambling, expanding networks of chat rooms. Compulsive shopping may be triggered by the ease of getting credit, a materialistic view of life. It isn't who you are, but what you have. A barrage of advertisements on TV, catalogs, 24-hour home shopping networks, internet shopping, internet auction sites. It has been observed that there is a history of emotional, physical, and sexual abuse in the lives of many of the individuals who suffer from compulsive behaviors. Engaging in behavior can lead to compulsive behavior. Engaging in the behavior can lead to compulsive behavior. A big payday when gambling. Eater takes in excessive sugars and fats and changes the body's chemistry. Now they eat to be happy. Being able to buy something that the individual wants makes them shop with the anticipation that they will find another coveted item. Participation in ritualized masturbation, compulsive viewing of pornography, or participation in other compulsive sexual behavior will make the individual avoid normal sexual behavior or emotional relationships. Compulsive gambling has skyrocketed in the last decade, with poker tournaments being shown on television and online gambling available. Last year, gambling revenues in the United States topped $75 billion. Last year, gambling revenues worldwide topped $125 billion. Gamblers Anonymous defines gambling as any betting or wagering for self or others, whether for money or not, no matter how slight or insignificant, whether the outcome is uncertain or depends upon chance or skill, constitutes gambling. Forms of gambling: casino-style gambling, poker, blackjack, craps, roulette, slot machines, video poker machines, horse and dog racing, jai-alai, bingo and raffles, state-run lotteries and keno, sports betting, both legal and illegal, Super Bowl office pools betting on golf, schoolyard games, lag pennies and flip coins, bar games, liar's dice, stock speculation such as day trading, commodities and options, and internet gambling. Gambling has been around since the dawn of man. Gambling bones have been found in human habitation sites that date back 40,000 years. This was not an old world phenomenon. Mayan digs have found gambling implements that closely resemble the dice and bones of other civilizations. Along with gambling has come attempts at prohibition. India in 1000 BC. During the Roman Empire, it was only for the aristocracy. Louis XIX of the Ninth of France in 1255. Henry VIII of England during the Victorian era in the United States. Gambling came to the United States with the British, but the corruption and the addictive behavior made the practice unpalatable, and it was banned. While it was banned in the East, as people moved across the Mississippi River, gambling was popular in the Wild West. Infected by the same corruption and Victorian morality, by 1910 it again was gone. Gambling didn't return until the 1970s. Since then, Atlantic City and Las Vegas have become gambling meccas, and Indian casinos have changed gambling attitudes, bringing in more money than the cities combined. 48 states have some form of gambling. The only two that don't are Utah and Hawaii. And if you ask yourself, why in the world would Utah and Hawaii not have any gambling? And the answer is the Mormon Church. Huge populations of Mormons in both Utah and Hawaii. Compulsive gambling, like any other addiction, comes in two forms: problem gambling and pathological gambling. Problem gambling is gambling behavior that causes problems in an individual's life, either psychologically, physically, sociologically, or vocationally. Pathological gambling is gambling behavior that is persistent and continual and significantly disrupts all aspects of an individual's life. The real difference between problem and pathological gamblers is often time and money. Problem gamblers can't afford to spend as much time and don't have the money to gamble as they want. They average losses of $3,000 per year. A pathological gambler spends far more time gambling and averages losses of $11,000 a year. The average debt for women entering Gamblers Anonymous is $60,000. The average debt for men entering Gamblers Anonymous is $100,000. Studies show that problem and pathological gamblers lose 10 to 20 times as much as non-problem gamblers. In a study in Connecticut, 47% of the casino patrons were problem or pathological gamblers, even though they only comprised 5% of the population. In Minnesota in 1993, it was discovered that 2% of the population generated 63% of the state gambling revenues. Harvard Medical School studies estimated that 125 million people in the United States gamble. 2,200,000 of these individuals are pathological gamblers. 5,300,000 of these individuals are problem gamblers. This didn't take into account the 1,100,000 adolescent pathological gamblers. Male compulsive gamblers outnumber female compulsive gamblers by 2 to 3 times. This may be changing with the increase of casinos and slot machines, as women are more likely to use gambling to escape depression, trauma, or relationship problems. Pathological gamblers tend to have other addictions. 25 to 63% of pathological gamblers have other behavioral or substance addictions. One study found that 73% of pathological gamblers had alcohol problems. The same study found that 38% of pathological gamblers had a drug problem. 60% smoked, 50% had mood disorders, 41% had anxiety disorders, 60% had personality disorders. The group that has seen the greatest rise of gambling is among older adults. One survey of residential and assisted care facilities found that 16% went to casinos and at least once a month. This behavior is exacerbated by casino-sponsored trips and day trips, which were found in 2/3 of the facilities. There are different types of gamblers. Recreational social gamblers are able to separate gambling from the rest of their lives. For professional gamblers, their main source of income is gambling, and because of this, they are able and willing to take losses in their business. Antisocial gamblers may steal to gamble and have no conscience about the thievery and corruption that they represent. There are two subtypes of pathological and problem gamblers. Action-seeking gamblers are frenetic, excited, and are always seeking to escape. Escape-seeking gamblers are drawn to gambling machines and are often responsible people with good jobs, but they begin gambling to escape from their emotions or just to escape boredom. The systems of persistent, recurrent pathological gambling, preoccupation with gambling, reliving past gambling experiences, planning future gambling, increasing the amount of money used to gamble, unsuccessful attempts at stopping or curbing gambling, restlessness and irritability when not gambling, using gambling as an escape, chasing, trying to recoup past losses, lying about gambling, financing gambling through illegal acts, jeopardizing your job, your relationship, and education to gamble, expecting others to bail out the gambler's debt. The winning phase in the beginning, the bets are small and they are happy just to win or break even. But as recreation becomes compulsion, the reward becomes more the stimulation of the action, and they seek to prolong the action as long as they possibly can. Winning becomes secondary to staying in the game. In 70 to 80% of the cases with compulsive gamblers, the beginning to their craving for gambling started with a big win. The gambler begins spending more time wagering, and their conversations are salted with lionizing their wins and, when mentioned, minimizing their losses. But often they don't talk about their losses. They only talk about their big wins as if they've accumulated all this money. The losing phase begins with a losing streak, which is inevitable due to the simple laws of chance. Their large losses are met with larger wages to try to recoup their previous losses, and this is known as chasing. As the gambler continues to lose, they will dip into depression. They will seek isolation, become irritable, and lie about their situation. The desperation phase. In the desperation phase, the pathological gambler may lose their job, max out their credit cards, borrow money from friends and family, perhaps turn to illegal activities to hide their addiction, theft, embezzlement, drug dealing. The gambler may bankrupt their family and suffer from divorce. The giving up phase. In the giving up phase, the gambler is no longer trying to recoup their losses, but seeks the game to stay in the action. 72% of gamblers experience depression when they hit bottom. Suicide attempts occurred in 17 to 24% of these gamblers when bottom was hit. This is usually the time when the gambler seeks treatment. For the compulsive gambler, it isn't the money that they are seeking, but the rush from the large win and the zoning out of their gambling that their gambling affords them. About 1/3 of compulsive gamblers recover on their own, usually triggered by devastating financial losses. For the other 2/3 who seek treatment, the techniques used include antidepressant therapy, anti-craving drugs such as naltrexone, and Gamblers Anonymous. Compulsive shoppers and hoarders have the same cravings as do gamblers and drug addicts, but in this the high is caused by the feeling that they get when they purchase an item. 74% of the time, compulsive buyers purchase items on impulse. 50% of the household income for these compulsive shoppers goes to paying their shopping debts. Compulsive shoppers tend to buy items that enhance their sense of uniqueness. Women buy jewelry, clothes, and cosmetics. Men buy high-tech electronics and sporting equipment. Depression seems to be the main impetus behind their compulsive shopping. It seems worse during the winter holidays, so this is the time when they accrue 40% of their debt. Antidepressants reduce their urge to compulsive shop. Collecting, accumulating, and hoarding are offshoots of compulsive shopping. The individuals gain self-worth and self-esteem from the objects they own. These collectors and hoarders may buy valuable items, contemporary fads, or accumulate valueless items. There are cases of people who are unable to throw newspapers and magazines away. People will also hoard animals, cats, dogs, birds. One time in Montana, this guy had over 200 goats. I won't tell you what happened. In 1980, 15% of the adult population in the United States were considered obese. By 2005, 33% of the adult U.S. population were considered obese. Tragically, only 33% of the adult population are of normal weight. The average height of the United States female is 5'4" with a weight of 164 pounds. The average model in the United States is 5'9" with a weight of 110 pounds. So what's the difference? This is normal, and this is what models look like. This is normal, and this is what models look like. This is normal. This is what models look like. There are 3 eating disorders: anorexia nervosa, which is body image distortion and an addiction to lose weight; bulimia nervosa, eating excessive amounts of food and then controlling weight by purging, vomiting, fasting, or excessive exercise; and binge eating disorder, eating excessive amounts of food with no attempt at weight control. Compulsive eaters feel powerless when dealing with food. These individuals tend to be obsessed with food. They use food to escape undesirable feelings such as boredom and depression. Secretive behavior, guilt, denial, continued overeating behavior despite the harm done. Eating disorders seem to be a combination of genetic, neurochemical, psychological development, and sociocultural factors. 9.3% of the U.S. adult population is diabetic. That's 19,300,000 people. 26% of the U.S. adult population are at risk for diabetes. That's another 54 million people. 15.5% of American Indian adults has diabetes. 10% of African American adults has diabetes. 6.5% of Mexican American adults has diabetes. 5.6% of white adults has diabetes. It is not uncommon for someone with an eating disorder to have a co-occurring disorder as well. 12 to 18% of anorexics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. 30 to 70% of bulimics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. There's a reason why I have a picture of Kaley Cuoco here. The reason has to do with the fact that when she first started the Big Bang Theory, she was addicted to an over-the-counter medication. That over-the-counter medication was Afrin. She was afraid that she wouldn't be able to say her lines because her nose would be stopped up. And that's what Afrin does. It clears your nasal passages. So she was spraying this stuff all over. She was spraying this stuff every chance she got. Now, the problem with Afrin is it was developed by the United States Air Force for pilots so that they could fly if they had a cold. And it really does open your nasal passages. But if you use it for more than 3 days, it starts your nose starts hemorrhaging. And that's one of the problems that Kaley Cuoco had. Most eating disorders begin during adolescence. They tend to be chronic and affect women more than men. 3% of women suffer from one of the 3 eating disorders. In high school, 33% of the girls and 16% of the boys show symptoms of one of the eating disorders. This is Snooki from Jersey Shore. The reason I have Snooki up here is because Snooki was anorexic when she was in high school. And then she gained weight for Jersey Shore, and she was real popular. And then all of a sudden, after the television show was over with, she went back to anorexia again. One of the frightening statistics dealing with anorexia is that the age of onset has dropped from 13 years to 9 years. Third-grade girls are starting to diet and starve themselves to look thin. Anorexics seem to have a fear of gaining weight. These individuals tend to have a tendency to perfectionism and low self-esteem. Death rates for anorexics range from 4 to 20%. Bulimia nervosa is a disorder characterized by binge eating and the obsessively ridding oneself of the food that has been eaten, either through vomiting, laxatives, diuretics, or excessive exercise. Bulimia actually means ox hunger, as in hungry enough to eat an ox. When binging, these individuals eat as if they were famished to the point of uncomfortably distending their stomachs. These individuals are notorious for eating and purging in secret. A bulimic will often have secret stashes of forbidden food stashed away throughout their house, and they can eat in private and purge quickly. Much of the cause of bulimia, in particular, and eating disorders in general, stems from perceptions of acceptable appearance for females on television. When television was introduced to Fiji, 3% of women on the island vomited to stay slender. 3 years later, the percentage of vomiters was 15%. Fashion models maintain a body weight 13 to 19% below that of women they are modeling the clothes for. And there's an example right there. Ouch. While binging and purging may occur millions of times a week around the United States, it is not without its negative effects. Dental complications, greater possibility of alcohol abuse, greater possibility of drug abuse, high rate of depression, greater risk of suicide, stomach acid burns to the esophagus and throat, loss of tooth enamel, heart problems, especially arrhythmias, menstrual problems, and electrolyte imbalances. Binge eating disorder has become an international problem. For the first time in history of humanity, there are as many people in the world who are overweight as those who are underweight. In the United States, where obesity is defined as more than 30 pounds over one's ideal weight, obesity has increased from 15% in 1980 to 33% in 2005. Now, this is a happy story because this lady was a compulsive eater. And she stopped. This is when she stopped, and this is the way she looks today. Binge eating disorder affects 4.6% of the population at large. Binge eating is eating until the individual is uncomfortably full. People tend to be eating in response to emotional states rather than the true hunger signals. These individuals tend to have frequent episodes of eating large quantities of food, feeling a lack of control where food is concerned, eating rapidly and swallowing food without chewing, eating despite being uncomfortably full, eating when not feeling hungry, eating away from others so that they won't see your volume of intake, feeling disgusted because of the lack of control of food, having a preference for high carbohydrates and foods with high fat content, or junk food. Binge and compulsive eaters do not seem to know how to pace themselves, eating rapidly and in massive amounts until they feel painfully uncomfortable. Such eating may be done to control anxiety. Food seems to have a calming and sedating effect on some people. Adolescents who eat when they are depressed are twice as likely to suffer from obesity or bulimia. They are also twice as likely to suffer from anorexia. Compulsive overeaters are more likely to suffer from high blood pressure, high cholesterol, circulatory problems, heart disease, type 2 diabetes. 15 million Americans have type 2 diabetes. Sleep apnea, gallbladder disease, gout, arthritis, 15 to 60% greater risk of cancer. They exhibit high rates of depression. They become distressed and develop a negative body image. They allow their self-esteem to suffer badly. Sexual addiction is marked by sexual behavior that the individual has little control over and little choice. This type of behavior might be practiced by young or old, gay or straight, and male or female. The addiction not only includes sexual contact with another individual, but arousal through masturbation, viewing pornography, serial affairs, phone sex, visits to topless bars, and visits to strip shows. Sometimes sexual addiction can involve illegal activity, prostitution, sexual harassment, sexual abuse, exhibitionism, this is a picture of, child molestation, rape, and potential incest. By 2007, there were over 4 million pornographic sites on the internet. 40 million Americans visit these sites regularly. 70% of the visits are during work hours. 10% of the people surfing the porno sites are addicted to online pornography and spend up to 8 hours a day viewing sexual material. Worldwide, the pornography industry clears $57 billion a year. In the United States, pornographic industry clears $12 billion a year. Much of the pornography is filmed and photographed in San Fernando Valley outside of Los Angeles. 3 to 6% of the U.S. population are sex addicts. 80% of sex addicts are male. Sexual addiction usually starts in the teen years and then peaks between ages 20 and 40, after which it slowly declines. Sexual addicts seem to suffer from other addictions in conjunction with their sexual problem. The DSM-5 identifies several paraphilias: exhibitionism, fetishism, voyeurism, pedophilia, sexual masochism, sexual sadism, transvestic fetishism, voyeurism. Exhibitionism is where you show your naked self to somebody that doesn't want to see it. Fetish can be any of these things. Voyeurism is rubbing yourself against somebody. This is usually done in the subway or in a train or someplace where you're around people that don't know you. Pedophilia, of course, is sexual intercourse with an underage person. Sexual masochism is where you like to be hurt. Sexual sadism is where you like to hurt others. Transvestic fetishism is where you dress like the opposite sex. And voyeurism is what he's doing. He's watching this lady undress. Other sexual addictions include love addiction, the desire to fall in love and be in love; relationship addiction, the need to be in a relationship with an individual. It may mean maintaining multiple relationships at any one time. Individuals suffering from any sexual addiction maintain little, if any, control over their behavior despite adverse consequences. The individual will continue to obsess over the behavior of the distraction of everything else. Compulsive sexual behavior is repeated because of the release of the pleasure-inducing neurotransmitters dopamine, enkephalin, and endorphin. Tolerance to these neurotransmitters leads to a need for the addict to spend more and more time in their sexual activity to gain the same mental benefits. Damage can be done to careers, relationships, self-image, and peace of mind. The sexual addiction becomes the driving force in the addict's life. Part of the drive for the addict may be the risk that they are taking to achieve their target behavior. Usually, the addict will culminate the behavior through orgasm, though in some cases it may involve exposure or fondling. The trigger behavior is often followed by remorse, guilt, fear of discovery, resolution to stop the behavior. The sexual behavior is often pursued with a sense of desperation, self-loathing, despair, and low self-image. Internet addicts seem to have no control over their need to log on. While the internet didn't really begin until 1993, today 4.5 billion people worldwide out of almost 8 billion people are connected to the internet. 15 to 20% of 1 billion have high-speed connections. In Canada and the United States, 90% of the populations are connected to the internet. The three main uses of the internet are gaming, seeking erotic material, and gambling. The internet is anonymous, it's inexpensive, it's controlled by the user, it's validating, it's rewarding, it's convenient, it's escapist. Systems of internet addiction include logging on at every chance at home or work. Non-addicts log on an average of 8 hours a week. That doesn't seem like very much. Oh, that's the non-addicts. Addicts may log on 40 plus hours a week. Obsessing about the internet, feeling irritable and anxious when not online. Time online increases to make the individual feel they have had enough. Losing track of time when online. Neglecting responsibilities to be online. Allowing relationships to deteriorate with spouses, coworkers, family, and friends. Posting more messages and downloading more and more data. Eating in front of the monitor, checking email frequently and more than once a day. And of course, that's an old statistic. Now people are checking their email constantly. Some internet addicts seek oblivion, wanting to zone out, while others seek frequent or constant interaction. Physical symptoms of internet overuse include blurred vision, chronic lack of sleep, twitching mouse fingers, relationship problems. The list of internet addictions includes cybersexual addiction, computer relationship addiction, internet compulsions, information addiction, and computer games addiction. Computer relationship addiction entails individuals dealing more and more in their online fantasy world. They pull more and more away from their real relationships until they lose them. Eventually, the addict's cyber world replaces and becomes the most important aspect of their life. For online gamers, the game might start offline, and then as they improve, they need the competition of the online games. Like any other online addiction, gamers lose track of time while they are playing. Some gamers will spend every free moment gaming. Men, teenagers, and children play online more than any other groups, whereas non-addicts will spend 20 to 60 minutes playing a game. A gamer will average 6 hours a day in their games. For the last 60 years, the most frightening non-substance addiction was television addiction. TV addicts may easily spend 6 to 8 hours a day watching. 60% of American homes contain 3 or more televisions. In many American homes, the television is on longer than their lights. The benchmarks for TV addiction: compulsive use, making the individual a couch potato, using television to change one's mood, sedative or antidepressant, craving use, loss of control, continued use despite adverse consequences, development of tolerance. The average adolescent watches TV for 1,500 hours a year as compared to 900 hours of school. The shows that an addict watches skews how they see reality and leads them to make poor decisions. Since television shows dysfunction as normal, adolescents have a hard time accepting their own culture as real. Commercials for fast food may lead to compulsive fatty food consumption. News focuses on negative events, leads the individual to skew towards seeing the world as an especially dangerous place. A study in New Zealand showed that the more the child watched television between ages 5 and 15, the less likely they were to graduate from high school or go to college. There are over 260 million cell phone users in the United States. There are over 6 billion cell phone users around the world. Calling and texting takes up a large part of a teenager's day, to the exclusion of studying or engaging in face-to-face relationships. And that is finally the end of the chapter. I almost went to sleep, didn't quite. You might have noticed I drifted off there a little bit at the end of some pages. I'll talk to you next week. That's the last addiction. Next week we talk about something even more exciting, is trying to get over your addiction, I guess.